All right, here at Advanced Perio, our full name is actually Advanced Periodontics, Microsurgery, and Implantology of Seattle. So many people ask, why do you have microsurgery in your practice name? Microsurgery comes from our use of the surgical microscope, as well as using loupes that have very high magnification. Why does that benefit our patients? Well, when you do things under very high magnification, you can do things very precisely. You can make smaller incisions. You can do less invasive surgeries. I use a global microscope for my surgeries. This microscope has a great light source. It allows me to sit upright and see very clearly what I'm doing at a very high magnification level. I can also use this camera to take videos of procedures and share those with patients and with doctors who refer to our office. And so it's a great educational tool as well. Other parts of microsurgery that are really important, when you do microsurgery, you want to be in a seated posture. We use special microsurgical chairs with large armrests, and what that does is it takes away your large muscles, which can get fatigued and start to twitch and give you a little bit of jitteriness. So you don't want to have any jitteriness under a microscope. So no caffeine, for instance, that can make you a little too shaky. You want to be very stable with what you do. So when I work under the microscope, I make sure my posture is excellent, everything's supported, and I really only use the fine muscles in my fingers to ensure that my movements are extremely precise and there's no jitter. Other parts of microsurgery that allow you to use your fine muscles are using things like this. This is a pack of microsurgical instruments. Open that up here. So these are made by the Microsurgical Training Institute, and these are especially designed, originally conceived of by Dr. Dennis Shanalek, and they're blue because they're made out of titanium, and they're extremely light, and they're rounded so that you can move very fine movements as you do your surgeries. This allows us to do our surgeries, again, without having to put our fingers in patients' mouths, which would be more like macrosurgery, and also to use very small incisions and very small sutures. The level of suture we use in our practice is, generally speaking, something along the lines of this. This is a 7-0 suture. Sutures are ranked by the number of O's or zeros. You'll find in many dental practices a 4-0, which is a very large suture with a very large invasive needle, is used as their main suture. As you go to 5-0, 6-0, and up to 7-0, you get more towards the level of ophthalmic sutures. They're extremely small and delicate. The needle's very tiny. This one is 11 millimeters long, and it makes very non-invasive incisions as stitches go through the tissue. So what that means for our patients is that they heal faster. They have very fine stitches that aren't as bothersome to their tongue, and all of our incision lines are closed up very precisely because we can use such small, delicate stitches. A couple other things that are worth talking about with the microscope. When we use the microscope afterwards, what I find is that it makes me a better surgeon on all of my cases because I've been able to see what I'm doing at such high precision, and it adds a level of challenge and precision that I need to train my brain and my muscles. And when I go to regular surgical work without the microscope, I find all of my surgeries thereafter are much more precise. So it not only works to our patient's benefit, but it trains me to be better and better as we go. So at Advanced Perio, the microscope is one of the prominent features in our office, and it has so many benefits both for our patients and for our referring offices because everybody has a great experience when they have microsurgery. They have very minimal swelling, bruising, and really smooth healing.